All right, 5 reasons why mouth breathing is terrible for your health. Reason 1, mouth breathing encourages rapid, shallow breaths. This decreases our lung capacity. Reason 2 is that it increases blood pressure and our resting heart rate. This contributes to a general sense of anxiety. Reason 3 is that it dehydrates us. Reason 4 is that it increases our dental hygiene issues and contributes to terrible breath. And reason 5 is that it can contribute to sleep apnea and snoring. So why is nose breathing better? Nose breathing encourages slower, deeper breaths. This lowers our resting heart rate, lowers our blood pressure, increases our sense of calmness. It filters out pollutants and hydrates the air in our lungs. It improves our dental hygiene, and it improves symptoms of snoring and sleep apnea. So the first step to fixing this is to identify whether you're a mouth breather or not. All it takes is you to be a little mindful of your breathing throughout the day, and if you have a sleep partner, then to have them monitor how you breathe throughout your sleep. So hopefully for them, that does not entail a lot of snoring. But if it does, then you have your answer. So it is possible to consciously train yourself to become a nose breather. Now, if you are struggling, especially in your sleep, there is something called mouth tape, where you basically tape your mouth shut during your sleep, and then you breathe through your nose. Now, if you mechanically are not able to breathe through your nose, it's not such a great idea to tape your mouth shut. And you'll know this when you tape your mouth shut and you all of a sudden cannot breathe. So there are 2 other devices that can be used to help functional airway issues of the nose. So one is a dilator stent for the external valve of the nose. People who can benefit from this are people who end up noticing collapse of the nostril when they take deep breaths. The next is a dilator of the internal valve of the nose. That's the upper cartilage of the nose. And these are breathing strips that help pull the nose open. People who can benefit from that are if you notice an improvement in your breathing by pulling your cheek out, then you may have some internal valve collapse. Now, both of these functional issues can be addressed in a rhinoplasty. So if you are suffering from functional breathing issues of the nose, call a plastic surgeon and look into a rhinoplasty. And if you are interested in learning more about breathing, there are 2 authors, James Nestor and Wim Hof, whose work I highly recommend.